Estás en sintonía con WCEA-TV, tu canal hispano.
We'd actually also love to hear from all of you about what you're hearing and what we can do to help.
I heard there's some confusion sometimes with people I have talked with about like the February 15th deadline versus the December 23rd.
Yes.
So is that something that you find common when you knock doors and you talk with people, like they don't know which of the deadlines apply to them?
There has been some, it's not top of people's mind. I think as they're getting mailings and reminders, they are becoming increasingly aware of what their particular deadline is. Actually, the December 23rd deadline is very important for people who need coverage January 1st, and we are finding that more and more people know when their coverage ends. So we need them to fill out an application and pay for coverage if they're required to pay.
We do recognize that there are people who are getting some different dates for when their coverage lapses, so there is some confusion out there. Broadly speaking, though, we really are asking people to think about ensuring for January 1st coverage. They have to take an action by December 23rd. The other thing, just to note, today is the last day for federal, so not outside of Massachusetts, today is the last day using HealthCare.gov to get access. There are some newscasts saying that that's true in Massachusetts. Just wanted to make sure that it's not. The date in Massachusetts is December 23rd. We actually worked really hard to push it to December 23rd to give individuals as much time as possible for that 1/1 coverage.
So if someone doesn't have the time to like go on December the 23rd, do you have another option for them? Like,
so, not for coverage for January 1st. So if you want to be covered for January 1st, you really need to take this action by December 23rd. And that's really what we're trying to make sure people are aware of.
And it's just critically important that we not lose groups because they don't know about the deadline. So the more people we can help people understand that they will not be covered unless they take action December 23rd. The more attention, there's a little bit of time between now and then. So if people are wondering if they need to do something, they need to pick up the phone or go see one of their local navigators or assisters to help figure out what they're required to do.
It takes, by the way, about 45 minutes to an hour. If you have a bigger family or some other things, it can take a little longer. But and the big benefit, as we've all said, is real-time determination. So if you get help on the website, at the end of this process, you will know exactly what you're eligible for. So it's really well worth taking that 45 minutes to an hour. Get all your documentation that you need together, because healthcare can be complicated. You got to make sure that you have all the necessary documents. But the website, again, and our assisters can help people understand what they need to prepare for, what information they need to have. And then the process is actually very smooth. Yeah?
What's your criteria for door knocking?
The door knocking campaign is, we've looked at the state map. We've identified hotspots essentially where people are more likely to have temporary coverage, and we are using census data to identify the walking TERFs. So it's about a 3-step decision process, and then we're going to every single door in that area.
Diane from Boston, Korea. There are a lot of Korean people who are older, who have difficulty using the online website. So there are some people who prefer paper works, even though we encourage online works. But then, do they still have the same deadline for the January 1st? Because I'm pretty sure it takes longer than online working.
So paper definitely takes longer to process, but the timelines are still the same. And like you said, we're definitely prefer people even if they want to do paper, if they actually find an assister who can help them file their application online, that is actually preferable to paper. That being said, paper applications are available, and we're happy to take them, and we do. It does slow down the processing, but the timelines remain the same. If we see people getting close to that timeline who have an issue, we will work with them to ensure, as we talked about, no gaps in coverage. So we really, first and foremost, most important to us is coverage. And we'll work with anyone who's coming close to that timeline but who doesn't have access to a computer or doesn't want to use one.
How long does it take to process the paper application?
It
The
should
average
take
time?
2 to 3 days. Depending on the volume that we get in, though, it can take longer, and lately we've been getting a little bit more, so it's starting to take a little longer. As we get closer to that December 23rd date, we need to be more careful about our ability to make sure that we can get everybody in the door. But if we cannot, we will make sure to work with those families and those individuals to ensure that there is a level of coverage that's covering them.
Yeah, I think that's really important because the disadvantage of paper is that you don't have real-time feedback on whether the information entry is correct, and that could significantly slow things down because you may get the feedback and say you actually didn't fill out it right and you have to do another round. So using the phone, that could ensure that the application is actually done correctly and that you can get the determination right away.
I think the other thing is people want to, because health coverage is confusing, they're not sure if they have access to purchasing health insurance on the connector side. They're just not sure what the different plans mean and what the different concepts are with a high deductible or low premiums. We're getting a lot of questions and calls about that, and there's just lots of education that needs to happen. That's really where we highly recommend that the community find those assisters and those navigators in order to help kind of understand the type of health insurance that's available to you.
We say that most of the times when there is some situation like this, for example, like I'm doing my application and then I stop with it because I don't know about the immigration document or about the health insurance types. With a phone call, most of the times it's solved.
Yes, absolutely. We can usually solve it very quickly that way, and then you can continue on and you finish your application online. Some of the enrollment fairs have been really good, and that's what we do. We actually get people with laptops set up. It's not quite as mobile as we'd like, but it's pretty good. And like you said, we had a couple scheduled. Again, if you know of pockets within certain communities that could really use a physical enrollment fair because you know they're more likely to show up for help. If we're there, then we'd love to be able to schedule something with you. They take a lot of time and energy for us, but we'd absolutely do that if you thought it was helpful.
We also have a list of community events where we are already planning to be present. We're happy to get those to you if that would be helpful to publish those to the folks who read and listen and watch you. We can absolutely give you that list of events.
Because a lot of the challenges, actually not challenge, but just things that we need to resolve about these events are actually just venue and facility. Because once we know, if there's a place we can go, we can pull together a team and go there pretty flexibly. So if you know a place that's available and the people are going to show, we're there.
Open enrollment ends on February 15th. And so this is the window. It's between now and February 15th. It's 2 more months. And again, for 1/1 coverage, it's reaching them in the next 2 weeks. But to your point, even if they miss it, open enrollment does continue into January, and so you'll continue to hear from us, and we'll continue to push as many people to kind of come in and see what they're eligible for.
Great. Everyone's all set? Okay.
Well, thank you
Thank
so much
you.
for
Thank
coming.
you
Really
very
appreciate
much.
it.
We really appreciate it. And we will get you a list of the events, the community events where we're already planning to be, and if there are others, it's a great idea to add us.
Esto es El Planeta Hoy, desde una conferencia de prensa del Health Connector y HealthCare for All. El mensaje de hoy es muy claro y sencillo. Actúe lo más rápido que pueda. Y estoy con María González de HealthCare for All, quien nos ayudará a dar más detalles sobre lo que ustedes, amigos televidentes, deben de hacer para asegurar su cobertura de salud. María, ¿qué nos puedes contar? ¿Qué es importante que nuestros televidentes sepan?
Bueno, hoy estamos haciendo un llamamiento, una llamada a aquellas personas que tienen más health temporal para que rellenen su solicitud lo antes posible porque este programa se acaba. Y sobre todo estamos hablando con aquellas personas que quieren cobertura para el 1 de enero del 2015. Y es que si no rellenan su aplicación, su solicitud, después escogen un plan y en tercer lugar pagan por esa cuota mensual, esa prima, para el día 23 de diciembre, no van a tener cobertura para el 1 de enero.
Entonces es muy importante actuar lo más pronto posible. María, el website este año yo lo he probado, está perfecto, no tiene ningún problema. ¿Qué pasa si las personas tienen un poquito de miedo de todas maneras de ir online y de llenar la aplicación en el website? ¿Qué pueden hacer?
Bueno, lo cierto es que la página web solo está en inglés, entonces si la persona, por ejemplo, no habla inglés muy bien y tiene dificultades para seguir quizá los pasos en este idioma, siempre pueden acudir a algún navegador o algún consejero certificado para rellenar estas solicitudes. Los hay a lo largo de todas las ciudades, tenemos navegadores, hay 15 navegadores a lo largo de Massachusetts, dependiendo de dónde están ubicados. Si están en la zona de Boston, por ejemplo, tenemos al Boston Public Health Commission, que les puede ayudar directamente en persona. También pueden llamar al Health Connector por teléfono, tienen bastantes idiomas. Pueden llamar directamente al número que ven en pantalla, que es el número de la línea de ayuda de HealthCare for All, y también pueden obviamente acudir a su centro comunitario de salud, donde las personas le pueden ayudar a rellenar la solicitud. Entonces tienen un montón de opciones, todas estas opciones están en varios idiomas, entonces no tienen el por qué tener miedo a acudir a la página web, porque la página web funciona, pero simplemente por el obstáculo del idioma pueden acudir a otros recursos a lo largo de la comunidad.
Al hablar con personas de HealthCare for All nos hemos dado cuenta que los navegadores son personas que saben cómo solucionar todo tipo de problemas. Sí. ¿Puedes contarnos un poquito más qué es el navegador y su nivel de conocimiento tan bueno que pueden ayudarte a resolver problemas en segundos?
Exactamente, bueno, los navegadores son unas organizaciones que han sido escogidas por el Health Connector. Es un requisito federal, del gobierno federal, tener estas organizaciones que hablan diferentes idiomas, que conocen a la comunidad, que están ubicados, por ejemplo, hay uno en Everett, hay otro en Boston, también MAPS, que está ubicado en Cambridge. Estas organizaciones hacen eventos, o sea, que proveen información, además de hacer inscripciones, y conocen a la comunidad, hablan los idiomas, conocen ese proceso de solicitud del primer paso hasta el final, saben qué documentos migratorios necesitan las personas. Entonces yo siempre recomiendo que llamen a los navegadores y que pregunten y que pidan una cita para poder realizar ese trámite.
Entonces lo escucharon, amigos televidentes, actúe hoy antes del 23 de diciembre si es que tiene que pagar por su seguro para que se reinscriba, pase las fiestas tranquilo, sin ningún peso encima. Y también el deadline del 15 de febrero, ¿para quién es? Para diferenciarlos.
Bueno, hay varias fechas límite, dependiendo de cuando la persona solicitó el más health temporal el año pasado, tienen diferentes límites. Aún así, yo les estoy diciendo que no esperen al 15 de febrero, que lo hagan lo antes posible, y que sí es cierto que algunas personas, las que solicitaron este seguro el año pasado más tarde, tienen hasta el 15 de febrero, pero si se les pasa esa fecha, entonces después no van a tener cobertura. Como no pierden nada en hacer la aplicación ahora, háganlo y asegúrense que para el 1 de enero ya tienen cobertura.
¿Lo escucharon? Hágalo hoy mismo, vea este programa y hágalo ya. Esta fue María González. Muchas gracias, María.
Muchas gracias. Felices fiestas.